Washington, D.C. has had two major health cover-ups blowing up in the same week, in the same building, and frankly, the more honest one belongs to a man who disappeared from Congress for 4 months, and he got called embarrassing by his own party for explaining why. And look, let's start with Mitch McConnell, 84 years old. And on June 14th, dispatchers sent an advanced life support ambulance to his D.C. home at 8:36 in the morning after he was found unconscious. His office's entire public statement that day was just saying that he was receiving excellent care. No diagnosis, no details, and nothing meaningful since. Just a follow-up 2 weeks later saying he was working closely with staff on Senate business. And the only reason any of this has become public at all is because a journalist obtained the actual dispatch audio and posted it this week. And this is Mitch's second hospitalization this year, because he spent 8 days in February in the hospital for flu-like symptoms, and we've already had the documented run of falls, concussions, and those public freezes mid-sentence. Thankfully, Mitch is not running again. His term ends in January. But he is choosing to hang on to this office while his office declines to tell the people he represents what is actually going on. And look, I'm not going to go this far, but there are people asking for proof of life, like this post, saying, is there a law that requires the Senate to disclose the death of a senator within a certain number of days? Hashtag, where is Mitch? This is genuinely weird stuff, and it's already had major impacts on the Senate. And over on the House side, you've got Tom Kean Jr., and we've covered this. He has vanished from the House for 4 months. He missed over 100 votes, and this week, he stood on the floor and told the truth. He had been hospitalized and diagnosed with depression, a real issue. And he's saying that depression is physical, it is emotional, and until you experience it yourself, it is difficult to fully understand how powerful this illness can be. And I've got to say, that is a genuinely brave thing to say, especially from that podium. And before I go any further, if you or anyone you know is struggling with mental health, know that you're not alone. And help is available. All you have to do is pick up your phone and call or text 988. But as for Tom Kean Jr. talking openly about his mental health struggles, the response has been cruel, especially from some of his own folks. Lauren Boebert, her response was to call it embarrassing and ask on camera who gets to take 4 months off work because they're sad.
But who gets to take 4 months off of work because they're sad? Like that's
well,
not.
It might not be sad. I mean, it's
depressed. He's depressed. He's sad, and okay, whatever the reasons may be, it's embarrassing.
And that leads me to ask, by the way, should Congress have some sort of disclosure standard for long absences, something between the total silence that we got and a press conference, or is that a privacy line that we shouldn't cross, even when a member is missing 100 votes? So tell me your thoughts in the comments below. Where would you draw the line? But you know, I've got to say that the party that's mocking one of their own for being honest about depression, that party spent last year gutting the system that treats it. Look, right now, the tax and spend Republicans passed cuts roughly $1 trillion for Medicaid over a decade. And they let the enhanced ACA subsidies expire, which the CBO says spikes premiums over 100% for millions of Americans. And it'll strip coverage for millions more. We've already seen the rural hospitals closing, and a Nebraska clinic in a town of 900 had to shut down entirely this year because of these costs. And so you have a congressman getting mocked because he's being straight about what's going on in his brain, and the people that are mocking him are those same ones that voted to make it harder for him and anyone to seek treatment, but especially for those that are not in Congress. And the other side, they're pointing out, look, there is a real privacy interest here, that public officials are still human beings, and not every hospitalization owes the public a spectacle. Fair. But as far as you can tell, Mitch McConnell has not been running anything. And you can't run the Mitch McConnell playbook of silence and the Boebert playbook of making fun of someone for being honest all at the same time. Either health honesty is owed to the public or it isn't. Pick one. And I've got to say, Kean said one more thing worth repeating. 50 million Americans deal with depression, and asking for help is strength, not weakness. And he's right. But go say that to the rural hospital in your state that just lost its maternity ward. Do me a favor, subscribe, because what Trump and his pals have done to the already lacking American healthcare system is disgusting. And we are not going to stop talking about it. And again, if you need help with your mental health, you're not alone. Just call or text 988.